All right. Okay. Jum, compliments of the season to you here.
Wish you the same. Wish you the same, man.
Yeah. Thank you so much for your time. Thanks for being such a lovely sister,
Oh,
colleague, friend.
oh,
Thank you
thank
for being
you.
the best.
Oh, thank you, ma. Thank you.
All
Thank you for
right.
being you
Yeah.
as well.
Compliments.
Wish you the
I
same.
appreciate you. Thank you for your assertiveness. Thanks you for your virtues. Thank you for all the wonderful things you've been doing. You are one
Thank
of the
you.
very enviable nurses we have on ground in the United Kingdom.
Wow. Okay.
Yeah,
Okay.
your articulation is top notch, and so we respect you for that. Thank you for
Okay. All
being
right.
a light to show the way. We appreciate you.
Thank you, ma.
So, my people at home, my own name is Fola Shade, and some people call me the name you see there, Mentor Shade. We have our beautiful Jumoke in the house. She is an articulate nurse, an assertive one, an hardworking one, and she's been in the specialty of infection prevention and control nursing in the United Kingdom for a long while. She will share her experience with us and let us know how people can come into this nice specialty. Then she will tell us some things about how to come into it, the benefits of being in it, the challenges of being there, so that people who are keen on becoming one will be able to make nice decisions, great choices. So you have her in the house. Please don't hesitate to load her with questions.
Okay.
She's very much up to the task. She will
Okay.
introduce herself, tell us her journey to the United Kingdom, and how she's been faring, then how she
Okay.
jumped into infection prevention and control. In fact, I'll be asking her a very critical question because I know the infection prevention and control nurses are very, very, no, no, I want to use, I want to use a very mild word, but on the word, they used to be very arrogant to be factual. So I'll
Wow.
be asking her that. She will let us know their reasons for being that. But I believe
Mm,
she possibly wasn't. But I used to, many of us see that in many of them. So she will tell us why they see themselves as very special breeds on the ward or in the clinical setting. So, Jimmy, you have the floor. Tell us about yourself. Then we launch into your specialty.
okay. Good evening, everyone. I'm Jumoke. I'm a staff nurse. I'm a registered nurse with in Nigeria and also here in UK. So diving into my journey right to UK, I came into UK I think 2019, and I think the journey started when I went to Lagos State University to do ophthalmic nursing. I work in Obafemi Awolowo University back at home in Nigeria. And I went to Lagos to do ophthalmic nursing. Getting there, I met some, young doctors and young nurses talking about traveling out and everything like that. And I was just like, wow, I'm really interested. And they gave me so many information. And that time, I also have another friend of mine who has already traveled down to UK here. So I contacted her and get some information. And getting back home after my ophthalmic nursing course, that's what I think that was a 1 year course. Getting back to IFE, then I started my preparation for IELTS, CBT, then search for job through an agency, and I came in. So my first hospital was that was Portsmouth University. Is it hospital? Portsmouth University? I can't remember.
Princess,
But
Princess Alex, is
uh,
it Princess Alexandra or
Queen
something?
Alexandra Hospital. I'm sorry.
Okay, yeah.
Yeah, Queen Alexandra Hospital in Portsmouth. That's where I came. That's my first hospital here, and I was working in Ward D6, which is an orthopedic ward, but it's an orthogeriatric ward then. And COVID happened, and my ward became a COVID ward. And I think I'm the first person that catch COVID that time in my ward. I was really sick. I came back, and since then, I've been really, really keen about IPC things. I was so interested on what is going on about COVID. Was a new guideline, was a new thing to do, how to, how to avoid transmission to patients, inpatient transmission, and everything. So after that, I moved to other wards. Then I moved from Portsmouth. I relocated here to Preston, and I work in that's just a plastic surgery ward for like a year. Then there's an opportunity that came out in infection prevention and control in Blackburn Hospital where I work presently, and I applied. And after applying, I know we're still going to dive into how I applied and some other things that make me to be one of the people that they chose for the interview, and I got the job. We're going to discuss that later. And that's just my journey to UK in a nutshell. Yeah.
Thank you very much.
Yes, ma'am.
Beautiful work. Take sweets. Yeah. Sweets. Yeah. Baby, take sweets. She's got to take sweets with grandma. Yeah, thank you. Tell us what is interesting about infection prevention and control.
Okay. There's so many things interesting. When I applied for my job, I never knew it's I know it's big, but I don't know. I never knew it's as big as that. Like
it's big. It's one
it,
of the specialties I really fear because
it's really big.
because you are like the lifeline of the whole hospital.
Yeah,
It's big.
more than
When you talk of norovirus, talk of MRSA, talk of it's big.
During my
It's
interview,
big.
when I applied for the job was a band 5 to 6 job. So it's a developmental role. So when I applied, I know about COVID. I know about C. diff. I know about MRSA. Then I think that's all I know. Then I know about hand washing. I know about source isolation. As a registered nurse, that's my knowledge. I never knew there is something big. So upon resuming, I was given a book as big as this to read up. Yeah. I was just like, wow. But I love to read. That's one thing about me. I love to read a lot. I can't stay. I don't know, since I think I entered School of Nursing since 2007. And 2007, I've been doing one course or the other. I never knew there is a year that I never do any course. So I'm used to reading. So they gave me all the books, and I'm seeing different kind of, organisms, MRSA, MSSA, ESBL, CRE, CPO, and all those. And I was like, okay, this is something big. And reading it, I was digesting. Then I was retrospecting. I was just thinking about my work on the ward, like, wow, I would have done this better. I would have done this better, and I would have done this better. So it made me to have so many rethink. And that's why, I don't know if anybody's watching from Royal Blackburn Hospital, if you've met me as an IPC nurse, if I've come to your ward and I told you about something, I will take my time, even if it's 2 minutes or 3 minutes. The reason why I'm asking you to do this, I will tell you, because most nurses on the ward don't really know much like that. And I think is, apart from the fact that people on the ward don't have the time to really delve into things like we would do. I don't expect you to know much, but just know the bits, the main thing. Another thing is COVID, staff nurses coming in from COVID. There's not been proper, maybe, education about so many things like that. Yeah. So IPC has a lot of work to be done, apart from the fact that we are helping the hospital, we are helping we are preventing the spread of infection. And it's not about preventing infection. We are preventing outbreak in the hospital, and we are also preventing. We have the job of also helping in preventing an individual. It's not about we are preventing the ward alone. We also help to prevent an individual, from getting infection. There's some people that are neutropenic, I know we are aware about that. So we do reverse isolation. If though the nurses on the ward themselves, even without telling them, some people also do that. But apart from looking into organism, looking at the risk factors, really doing the risk assessment of each organism, how they can affect other patients on the ward. We also carry out what we call audits. We do audit of the staff. We do hand hygiene audits for staffs. We do the ward audit at large. We also carry out an audit if there's an outbreak or if there's an impending outbreak. We carry out an environmental audit to see how the environment is, to see how the ward is, the dirtiness or the cleanliness. We look at how they carry out their activities, the use of PPEs, the use of gloves, the proper and hygiene, how they carry it out. And then also, we also do some jobs behind the curtain in the office. If there's an outbreak, we investigate into it. How does it happen? What happened? Why does it happen? Does it happen? Do we give this person this infection, or does the person bring this infection to the hospital? How can we learn from this in case such thing happen again? How can we prevent this in the nearest future? And all this research and audits we do backstage is being sent to the UKHSA, which is the Public Health England, and that's what they collate all this information from various hospitals, and it helps the UKHSA to prepare or to make new policies, to make new guidelines and everything like that. So it's a bigger job. And let me just dive into why it seems IPC nurses are quite strict and difficult. I
Now
have
you are
not.
using the word strict because I
Yeah,
see them as being please,
yeah.
this arrogance too much. Oh,
Well, let me just say, like, I think I had that discussion before with my colleagues at work, and it seems it's like the older generation of IPCs are the one that are quite, strict. It's been a while they've left ward, they've left the bedside, so they don't really know the stress, the the responsibility on a nurse on the ward. So there's like in my team, we have some we newbies, we are just young. All of us are young, but we just left. Some of us just leave bedside 1 year, 2 years, or 3 years ago. So we still understand what the staff nurses on the ward are passing through. So we try to let the elderly ones among us to understand, even if you're going, you try to communicate in a very nice manner, because I try to put myself in people's shoe before I go hard on people. And I have had cause to also be strict at times, because when you're trying to prevent an outbreak, prevent an infection or whatever, and you've given like a guideline, you've given an just an advice, because in that we advise, that's IPC, we advise, but the advice needs to be taken. Though it's an advice, and the advice will say you can take it, you cannot take it, but you have to take it actually. If either you are a consultant or anybody, you have to take it, because we are standing in gap as a UKHSA representative in an hospital. So if you give an advice, maybe there is a CPO, that's carbamazepine producing organism, patient that is positive with that patient has to be isolated, source isolated all through hospital stay. And if the patient come in, has to go into side room immediately, because the organism is really virulent, and it's easily transferable from our hands as an health professional. So maybe you've been to the ward, you've tell them, oh, blah, 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 this patient's in this bay, has to go into a side room, and you give them the reason why, and you give them everything. We have some nurses that they just take everything with levity. They will just be like, you don't understand. You're just coming from your office, you're coming to come and give me an instruction or whatever. And they will be telling you, there's no side room, there's no side room, there's no side room. And you'll be like, at least I'm the one. I know all the side room in this hospital, all the side room. I have them in my head. I have all the list. I can decide to go to another ward and sort a side room out and tell you or tell the belt team will be aware. So, telling staff nurses all those things, and maybe 2 days, 3 days later, you're still looking at the patients in the bed. You'll be like, you go mad. You go
Ah,
mad. Like you see us.
okay.
No, you go mad. Like, why are you doing this? Don't you understand? After all this documentation, after all this advice, that's what makes me mad, actually, not
Mm.
unnecessarily. It makes me furious. And you will know if I'm furious, they know. The words that I cover, they know. Once I'm furious, I'm going to tell you I'm furious and I'm not happy. I'm not happy because I told you about this patient is a CPO patient who needs to go into side room because the staff nurses are not going to do the bulk of the job. If there's an infection, it's going to fall back on me as an IPC nurse. So I'm going to start contact tracing. Do you understand contact tracing, and Shade? Contact tracing is like all the other patient this patient has been in contact with. I have to start contact tracing them from one word to the other, look at them, compile a list. After compiling the list, I have to start contacting all the wards to do a CRE screen on all of the patients. And they have to do 3 CRE screens 7 days apart. So I have to keep reminding, you can imagine all the workloads apart from the normal job that I have already. So I'm going to add that to my job. So that's why they always groom like, but some can be rude
That's
about
why
it.
you guys always grumble when you do.
Yeah. It's a lot of things. Like I can remember there was one time in my trust. It's more or less like I'm the one seeing all the CPOs in the bay. It got to a point I was just like, why am I the one saying it? Because if you see it, you have to sort it out. And the job is on me. A CPO patient in the bay, a multi-drug resistant organism patient in the bay, NDRO. You do contact tracing. And after doing the contact tracing, you print out a letter, you send a letter to the GPs to let them know their patient has been in contact. It's a lot of work. You draft the letter, you send it out, you send the patient's letter to the patient, then you go and explain. I don't know about other trusts, but in my trust, as an IPC nurse, you are the one. Apart from the staff nurse is going to tell the patient, you as an IPC nurse have to let the patients know, oh, while you are in this bay, we've made you to be in contact with a CPO patient. It's a lot of work. So that's why I think that's why they are a bit rude. Some are a bit rude, or let me say, they are a bit strict. Then apart from that, when there's an organism in maybe in a ward, and you are trying to let the staff nurses, these maybe the staff doctor or wherever, to understand the reason why you are giving an advice about a thing, and they are throwing it away. You can you can become like, why are you doing this? So I think that's then the main thing that make IPC nurses to be strict is the after effect of everything. Maybe an outbreak, a C. diff outbreak. They are still going to at the back. That's why there's a lot of work at the back. You do meetings on each outbreak that happened. After doing the meetings, you as an IP, you are not the one working on the wall. You are not the one that causes. You are the one that the execs. I only call them execs, the NHS execs. You are the one they will be asking question. You are the one UAKHSA will be ringing. Why did you allow this to happen? Why don't you do this on time? Why? But you've given the advice early. You've seen the patient.
So I
But the
get it
staff
now.
nurses on
So
the ward
the
didn't carry
change
out
is a
patient.
chain. It's a chain reaction thing.
Yeah,
It's a
you are
chain.
not trying to say this, but you are the one representing the ward. Even the ward manager might be in the meeting, or the matron. They won't direct the question to them. You as an IPC nurse is the one that they'll be directing the question to, and they'll be telling you have to do this, you have to do this. So you are the one who's going to action back, or you are the one who's going to do the research, do the audit, and doing the PIRs and
Yeah.
everything. So
Okay.
that's why.
Thank you very much. So we cut that stride now. Now, which courses did you take ahead of applying for your role? And how expensive are they? How readily available are they?
Okay. I would say if you want to become an IPC nurse, the first thing, if you are a current staff nurse One thing I would just say is number one, be interested in infection prevention and control while you are a registered nurse. Be interested in it because that should be reflected in your supporting statement, which is the main thing. They don't expect you to have any course in IPC. If you get a work as an IPC nurse, it's because it's when you become a maybe in some trust band 7, in some trust band 6. When you've entered, that's when they can put you up for maybe when when they are thinking you need to become a real specialist, then they will put you up for courses. Or I didn't do any course to get this job. The main thing was just like, I told you during COVID when I was in Queen Alexandra Hospital, I was really interested in COVID isolation. That was when I understand, even before UKHSS said migraine was one of the symptoms of COVID. I already knew migraine was because I was reading, getting information about what's happening in China and everything. So when I was putting up for the job, that's reflected in my supporting statement, and I really dwell. And I can remember when I was working in Nigeria, my first posting was in the infectious disease unit, ATHC. So I worked there for 1 month, and I and my friend, then we were one of the people that worked. There was an, I think it was a cholera outbreak in Ife at that time. So they bring all the patients to our hospital. So I was one of the people that volunteered to work in that unit that time. So it's reflected in my supporting statement. And also the one for COVID, it reflected. And I let them know how I'm always eager to carry out my infection control prevention, even in all units I've worked. And it is really true, actually, because so many of my colleagues know how I'm very, very keen. If you're working with me as an HC or my team member, I'm very keen about it because, there's a research that shows most of the transmission infection in the hospital is through the hands of the healthcare professionals. So I'm always keen about hand hygiene. If it's
Okay.
an organism that won't be killed by alcohol gel, I'm an advocate of soap and water. I'm an advocate of soap and water.
Okay.
But if can't use soap and water, just alcohol gel is fine. So those things that I mentioned, it reflected in my supporting statement, and I was called for the job and I got the job. So I did band 5, that my band 5 period was a learning period for me, that I was catching up on policies, on isolation things, on UKHSA guidelines, on different organisms, how they are spread, their management, and everything like that. Then I become a proper band 6. Then if I'm still in the team, I think I'll be going for my course next year. They will put me up for the course. It's either you do masters in infection control or you can do a PGD, postgraduate course in infection control, either one. And that's the main course. And if you're working with your trust, they should be able to put you up for it. If you applied, should be able to put you up for it. And I think another thing that really helped me is I was doing a master's in public health one time, though I've not finished. I put it on hold for now. So I was doing a master's in public health, and it's the epidemiology, reading about epidemiology of infection and everything. Oh my God, it's wowed my brain. Like there is more. I was reading about epidemiology in Nigeria, about so many things, and I saw a lot of things, and I was just like, okay. So I reflected that in my supporting statement as well, and during my interview as well, they asked me about epidemiology because that's one of the things we are called research, because you look at outbreak in your hospital, you collate it, and it's one of the things IPC do behind the curtain for the hospital as a large. From our own perspective, we collate outbreak, how many organisms we've had, because in UK there is a threshold of each organism that must happen in your hospital in a year. So that's another reason why the IPCs always grow. They are a bit
Mm.
strict. So the UKHSA have some organism that they called never. It must never happen. It must never be transferred to another patient in your hospital. It's a never happen infection. But if it happens, then they go gaga about it, and they try to investigate how it happens How was it transmitted? What are the things you didn't do right? How can you do things better moving forward? So yeah, that's just it.
Yeah,
PGD
you are doing well.
control
Thank you.
masters. Yeah.
Thank you very much. Thank you very much. Family members, if you have questions, please just type your questions there. I will finger point it for, I'll just tap on it for Jumoke to have a read and answer the questions. Please, this is a very good avenue for you to ask your questions to make clarifications. Now, Jumoke, how financially buoyant are infection control nurses, infection prevention and control nurses in the United Kingdom and in the world at large? To me, I rate them as maybe possibly the most challenging specialty in the hospital because any little goof like this, you can set the whole world on fire. We know what happened in that laboratory in China. Maybe just a little goof, maybe just a little mistake, and now it came to the whole world. That's one thing I really, really fear about infection prevention and control, because you actually have to know your honors when you are in that specialty, and you have to be able to stand on your feet like you are standing gidigba,
Yeah.
unshakable
Yeah.
with whatsoever decision you are making, that you know, oh, if it's bouncing back, I know I full ground like bag of semo, like
Yeah.
that.
Yes.
So, what are the benefits such that it's not only the stress that we see? So, what are the benefits in the, yeah? Because
In
whatsoever we
UK,
do, jump up and down,
yeah,
somersaults, walk with our heads or walk with our feet, whatsoever. This money too is part of the things that push everyone, part of those things that push everyone of us out of our beds and push us into the cold.
yeah,
And if
yeah,
you must push yourself into a very challenging role like this, then to me, I think it must really worth the whole stress. So, is this role financially beneficial to you guys?
well,
I'm not just talking about the 60%, 30% of a thing when you do nights or you do bank or you do Sunday or whatsoever. So or you do night. So I want to know, what are the core things I mean, where is the good money in infection prevention and control?
okay. Talking about money, I think from the NHS perspective, it's the same band, the same banding, and you even earn less compared to your band six counterparts who are on the ward, because those people, they work shifts, they work nights, they work day, they work weekends. If they do that, they earn more than you, because you're only paid basic salary. You work Monday to Friday, and you're off weekends. Then it depends on the trust as well. My trust do Monday to Friday, then we do calls. The calls, it's not like you're going to the ward like the doctors. You are in your house, and the switchboard have your number if you're on call that weekend. And if they need any advice on the ward, they put their call through to your phone, and you are paid. But it's not really a big money like that. It just depends. So talking from the NHS perspective, there's nothing much there. But I was I always say something. There's always a benefit in anything if you want to derive a benefit. So I'm going to talk about some other things you will learn as an IPC nurse, and that can be beneficial to you if you want to dive into maybe private. If you want to dive, you can work with all these vaccine companies if you want to. Can search for them. You can start working from home and you work with them as well. Because as an IPC nurse, you do all this auditing, you do all this research, you have knowledge about research, you have knowledge about epidemiology, which is those are the knowledge they are going to need from you if you're working with maybe vaccine companies or all these companies that produce maybe gloves or anything, I don't know, medications or whatever. So from that perspective, you can earn more if you want to go to work with all those other companies, private companies. But from NHS, our NHS, there's nothing much. It's just basic salary. It's basic salary.
Okay, thank you very much. Thank you very much. So, All those other ones that are financially beneficial that you mentioned.
Yeah.
So if I pick that role as a specialist in any of those organizations, what plus or minus pounds per annum in per thousand would I be expecting?
Well, there was one time I was looking on LinkedIn, not looking, I think so many, I'm on LinkedIn, I'm active on LinkedIn, and I do receive so many job offer from all these people as an IPC nurse. And to start with, I think it depends on your knowledge and maybe, as a private organization, you can, how will I say it? You can discuss about your price. You can price your salary.
Negotiate.
But I know one of my mentor who leave IPC to start with one of the big companies in UK. I think they're starting with 50 for her, and she's working from home.
£50,000.
Yeah, 50,000 plus per annum.
Okay, plus.
And the last time we spoke, she's telling me that because she also has the T viability experience. So she told them because they don't have anybody to take that about their product, she has to talk to them that they can add it to her, and they added more for her. So it's all about how you can discuss your price and everything like that. And maybe if you have more other things, you can add to them, you have other benefits they can gain from you. So yeah. But
Hmm.
NHS is just band six. If you're band seven, you're band seven. Band eight, you're band eight. Yeah.
Thank you very much. Thank you so much. Now, looking beyond the United Kingdom, if we can, how prominent are IPCs in other parts of the world? Is it the UK thing that make you guys big, or are you big outside the UK? Talk of Nigeria, Ghana, Cameroon, talk of the USA, talk of Singapore, New
Yeah.
Zealand, Canada, Republic of Ireland, Australia, just name it. Are you guys this big everywhere around the world, or is it the NHS that puffs you guys up?
Well, I don't know about other countries, but I know about UK. I know about Nigeria. In Nigeria, I don't think we really have infection control specialist nurses like that, except for nurses working in the infection control disease unit. I can talk of OHHC. Those are the ones that we have, and they don't go around. They don't go around like we go around. I don't think they have policies in place like here in UK. I don't know of other country, but I can talk a bit about US because some of my mentors, I have two mentors when I resumed to IPC. They've talked about USA to me. It's also a big deal in US as well.
Hmm,
Infection
it's a
control
big
is a big
deal.
deal in USA as well. But each country has a way of doing things. What we really focus on here, they don't focus like that. In UK, we focus on beer below the elbow. They are not beer below the elbow in USA. They don't pick people on that. But I was told because I have those my mentors, I think they sponsor them to go and do a training in US on infection control. So they know they tell me some things for fact. In US, they are more of hand hygiene with soap and water than even alcohol gel. So they are keen on that. But they are not really keen on we don't use earring, dropping earrings. We are do not touch your uniform, bear below the elbow thing and everything like that. But in US. So it's a big deal in US as well. And I believe if you enter infection prevention and control in UK and you do your course, if you get to US, maybe you should be able to do some things that would just make you to become a specialist there as well, because it's more or less same thing. We follow, they follow all these I can't remember the name, maybe CBC or something. We follow UKHSA, we follow NICE guideline. I think they follow NICE guideline as well.
Yeah.
But there's some things that are our organism is the same. It's the same way of source isolation. It's the same way of prevention, because at times when you are finding things out, I look at how they do things over there as well. I try to look at, okay, what are the ways they do things, because it's the same transmission, it's the same organism, it's the same virulence. They even look into more organism than us here. We group some organism together, but they try to, because why I know that is we are using a particular system in my trust currently, and I was delving into the system recently, and I'm looking at some organism. It's a system they use in US, but they bring it here for us to use. And I was looking at, even there's some organism we don't we don't look in. They look at organism like, what is it resistant to? What is that particular thing is resistant to? They go in depth to that extent. We will try to group it together so that we won't mess people's head up. We just tell them, oh, CPO, this, and they'll group it together. So it's a big deal in the US.
Thank you.
And I
So
think in all developing companies, in all developed countries, it should be a big deal. Yeah.
thank you. So looking at work-life balance, how is that to you guys over there?
Okay. So if you're looking for something, it's not physically tasking. So that's
Something light,
the benefit. It's not physically tasking, but it is
emotionally
mentally
draining.
tasking. You think, you document, you read as well. You think, you read, and you document. You have to. Those three is very, very paramount in IPC.
Make it
So that's why
sure.
if you are dyslexic, IPC can be for you, because you write a lot, you read a lot, and if you are someone that is easily distracted, you might know, because you might be doing 6 things at a time in IPC. You might be receiving a call from the world about a particular thing. You yourself, you are reading, you are attending to, maybe you are documenting on system. You are trying to listen to what's going on in the team about a particular word. It might be your word you're looking after. So from that, it's not physically tasking, but it's mentally tasking. But it's not a big deal. It's not something serious. There's always because it's a team. That's another thing I will always talk to people. If you're a band 5 in UK or wherever, see, if you're looking for where you'll be appreciated, go to specialists. Go to specialists. I always tell people that on the ward you might not be really appreciated. Even if they appreciate you, the person that is going to take that glory will be your ward manager or your nurse in charge. But in specialists, they will know that, oh, this one, she does this one, because you have your ward you're looking after, and the matron for that ward will be calling you. The nurse in charge will be calling you. Once you get to the ward, they will know that, oh, this is the IPC for our
She's
ward.
arrived.
So they will be like, even consultants. At times,
Modern witch is
I
here.
can say IPC is where I felt appreciated. Though I'm still going to come to that. So now coming to the work-life balance, it's a very good thing. So in my trust, we resume 7:30, and I drive down. I drive like 30 minutes from my home to where I work. It's another town entirely. But if your trust is in where you live, it's a very nice place. Honestly, you just resume. You finish 4 o'clock. I think there's some trusts that do 8 to 6. They do 24 hours, and some of them work 4 times in a week. They do their shift pattern like that. But we just work Monday to Friday. So 7:30 to 4 is fine. It's so nice for me. I get home 4:30. I can take my kids wherever they want to go. Their lessons and everything. I'm the one that become their driver. Like, I get home. It's not like I'm stressed like that. Apart from the stress of driving down from work home. There's no stress like that. Once you leave work, you know that, okay, I'm coming back to work tomorrow. You leave work at work. And when you're coming home, you're coming home. When you get home, you've got home, and you just carry on with your life. So it's very nice. Once, if you have a partner, if you have a husband in UK, or you have your wife, you guys just look at your shift and everything. Maybe someone will go on, you are going on, you are working Monday to Friday or Monday to Thursday or wherever, and maybe your partner will just work night shift and everything. But work-life balance is so nice. It's so good. It's good.
Thank you.
Yeah.
Thank you so much. Thank you so very much. So before you go, our family members back at home, if you have questions, pop it on the screen. Jumoke is here to answer. Before you go, if you are to uh, discourage someone from picking up this job, what is that single thing that you will finger point that you say, oh, for this very reason, don't go and work as an infection prevention and control nurse? What is it?
I don't have any.
That's if there's any.
I
If
don't
there is
have
none,
any.
let us know. But if there
I
is, just finger
I
pointing.
I don't have any. I don't have any reason why
None.
you can't work.
It
Yeah,
must
I
be
don't have
really
any.
groovy, groovy.
Except maybe if we are talking and I was trying to ask you a bit, maybe about your maybe your life, your personal life, or maybe I'm asking, are you this kind of patient to read some documents? Because you have to read a lot and also make notes. If I see that you are the type that, because there's some people that are clinical, they're just oriented to be clinical,
Yeah,
like
clinically
handwritten,
clinical.
they are good at that. They can't sit to read, to do all those type, to give documentation and not make any mistake. Yeah. So if you are not like that, there's no reason why you won't. Oh, thank you. There's no
Thank
reason
you,
why you shouldn't go into
Adenke is
IPC.
here to give us support. She's always been my
Thank
supportive
you, thank
vessel
you,
all
sis.
along. Thank you, T&C Foodie and Lifestyle. Guys here, T&C is a beautiful YouTuber. She's very, very cute with her skills in turning anything edible into essentially yummy and delicious and nutritious. So you just go into our channel, you have many things there that are very lovely delicacies, African delicacies, European delicacies that you can serenade your spouses, your friends, your family members with. Thank you, Tea and Seafoodie and Lifestyle, for being here.
Yeah.
Yeah.
So, like I was saying earlier on, I was talking about being appreciated. Um, Working on the ward, like I said, you might have so many challenges. You might work where you're not appreciated, or they just see you as the workforce. But being in a specialist team, they know that if you flop, is a team's flop.
Hmm.
So if you flop, is a team's flop. There's
So you
nothing like
always get
your
your each
home
other's backs.
a specialist. There's nothing like that. So if you want to be appreciated for your work, I would just recommend you can just look at one specialist team you're really keen about. And there's so many. There's so many. There is IPC, there is even there's urology, there is name it. There's this people that I met recently, all these I just know what they do is to insert NG tube. That's their major job that I saw that they do on the on the ward. So if you want to be appreciated for your work, yeah, you can go there because everybody will understand your effort and everybody will see it and you'll be appreciated accordingly. Like they will talk about it. People will talk about it. There's always meeting. Like I was thinking, like all my years of bedside, I've never seen. Though I've been on wards where we do ward meetings and everything like that, but it's not like being in a specialist team. There's periodically team meeting to see where are you now, your workload, what are we going to what have we been doing that is not sitting right with you. Your manager will be asking you, are you okay? Because you have to be okay for the team to be okay. Individual, everybody have to be okay for the team to be okay. They will ask you, do you need any help? Do you need any assistance? And you as a team member as well, when you see your colleagues struggling or whatever, you ask, do you need me to do that? Let me just do that for you. I'll sort it out. Don't worry. Then you feel appreciated for what you're doing. If you just want that thing, just go to the
Yeah.
team, go to any specialist team. And another thing is, I'm sorry to say this, being on the ward, you're doing everything. You are jack of all trade. And though people giving you things to do, they are not even working on the word. They just come and give you an advice or give you an instruction. You do this, you do this, you do this. And after you've done it and the patient is going, at the top, I always call them the execs, at the top is those specialist team that they say that has work. The doctors, the consultants, oh, the IPC, oh, this, they didn't let this thing happen. Oh, the urologist team, oh, the bladder irrigation team, oh, the digestive team, oh, this, and that. Those are the people, because those are the people that are going to go into the meeting and receive the appreciation, not the people on the ward. Though they will also
So
appreciate the ward
you
manager
are
and everything, but the
chilling with
major
the big
appreciation
guys.
is going into the specialist team. Oh, you've done this, whatever, you've done this. So yeah, that's what I can say. That's what I'm going to encourage. And another thing, I've been meaning to find a platform to say this to staff nurses, to registered nurses. Though I care to tell people that try to listen. Don't spend, I'm sorry to say this, but if it's a team, if it's a word which you really like and you are fulfilling there, stay there. If you are not if you are not fulfilling, you're not getting fulfilled, there's no big deal in leaving a team, in leaving a ward and going to another ward. One thing in this UK is once you work in a ward or in a team for 6 months, they count it as a, in Nigeria or maybe in African countries, we go to we go to specialist courses to get what do they call it, Anshade, to get all these, what they call, they will say you are a specialist in that area. But here in UK, once you work in an area for 6 months, and when you're there, at least 6 months, when you're there, you know what they are doing. And when you are asked, you can say this is that. You are a specialist in that area. So don't just sit in a particular ward for 3 years, 4 years. No, no. I can say what really helped
Explore.
me
The
in my
world is your
journey.
oyster.
Ma,
I said people should explore.
explore, please. Please explore. Explore. Like I can remember I was discussing with someone, that person was just like, you go all about. I go all about though. If I should start counting where I've worked in this UK, like
She's obsessed. She was going everywhere like a winch.
I'm I'm going, no,
That
I'm
was
going.
those words still crack me up anytime I remember. She said I was going everywhere like a winch.
Like a winch. I work in ortho geriatric for 1 year, I think 1 year, 3 months, or 1.5 years. Go to surgical assessment unit. When I was there, I make sure I know everything they are doing there. I know it. Like, what are they doing in this area? I know it. Plus all their adjuncts. Know it. Put it in your CV or just put it in your archive. When the time will be ripe for you to use it, it will come.
Thank you very much.
Yes,
Thank
ma'am.
you, thank you, thank you.
Yes,
Yeah, all well laid out for every one of us to have a good look at and then make beautiful decisions on what to do. Thank you so much, Jumoke.
you're
Family
welcome.
members, thank you, Denike. Denike has been very, very consistent in supporting my growth. So she won't say, oh, she's a big sister. She keeps supporting me because she knows I really need to grow.
Uh,
Thank you so much.
thank
And
you.
family members will be having Denike at some point. That's the T&C foodie and lifestyle CEO. For your information, she's an experienced mental health nurse and she's
Whoa.
coming around very soon to tell us about all around the issues of challenging behaviors in some people. It's going to be loud. So please keep a tab on this channel and be ready to flood here with your questions. Jumoke, thank you for being with me today and being with
Thank you for
everybody.
having
Thanks for
me.
sharing your experience. Thanks for opening the world of infection prevention and control nursing in the United Kingdom to everyone that cares to know and may want to explore the land. Thank you very much. And I
Thank
wish
you,
you a
ma.
very beautiful week and beautiful new year ahead. It will be
Wish
a
you the
year that
same.
will obey you in Jesus' name.
Amen.
And the
Amen.
year will obey everyone watching from far and wide in Jesus' name.
Amen.
Thank you so much. So hopefully if there's anyone that is keen on towing the path you've told, If they need your help, you may possibly be able to give a guide.
I'm ready, available. She knows.
Thank you. So you are ready to add more
I'm readily
to.
available. You can
Thank
just
you
get
very
my
much.
number from
Thank
Auntie
you.
Shade if you need
Thank
me.
you
Just
very
beat me
much.
on my
So it's a
WhatsApp.
safe place to say bye to the guys at home.
All right. So everybody, thank you for joining today. Thank you. I will be expecting you in IPC. And another
Thank
thing
you.
is I'll be expecting you to do better.
Yeah, we keep
What?
doing better.
Yeah.
We are
Thank you.
grateful.
Yeah,
Bye,
bye.
Jumi. Bye,
Bye.
family members. Thanks,
Bye.
Denike.
Bye.
Bye.